The expert, a lot of people went teal today. I guess, well, that's kind of a teal.
You're close.
I didn't even mean to do it. To raise awareness for ovarian cancer.
And Dr. Jacqueline Paykel with the Medical College of Wisconsin joining us live this afternoon to talk a little bit about ovarian cancer. A lot of people want to know, how common is it?
It is pretty common. About 1 in 80 women will suffer from ovarian cancer.
Okay, is this genetic? Is it passed on?
It can be. About 1 in 10 ovarian cancers are passed on, but most of them arise spontaneously.
When you talk about symptoms, what are they, and then is it difficult to diagnose? Do women just think, you know, I'm having some gastro issues, and they don't really pursue it as much as they should? Yes,
or the medical professionals don't pursue it as much as they should because they're so confounding. The types of symptoms that patients will come in with generally are bloating, nausea, getting full too soon, and abdominal girth growth.
Okay, you mentioned that there is a genetic component, but in most cases, though, it just kind of presents itself. Who's at risk? Who needs to be watching for symptoms?
Anybody with a mother, sister, daughter that's had ovarian cancer is certainly at risk. Anybody with 2 other relatives are certainly at risk as well.
Aside from genetics, which population groups should need to watch out for this?
Well, women between the ages of 50 and 75 are at highest risk, and women who have not had children or who have not breastfed. We think that birth control pills may be protective, and so those women might be at lower risk.
You mentioned a new study. Does the study shed some light on this cancer?
Well, it's interesting. We've been testing CA-125, which is a tumor marker, for a long period of time on high-risk patients who have relatives, and also doing ultrasounds. And now it looks like if you have CA-125 that increases from 1 year to the next, we can find it much sooner. So this is preliminary, but...
so through genetic testing, you'd be able to...
It's actually blood testing.
Blood testing. You'd be able to get it early, maybe.
Right, right.
You said birth control might be a protectant. What effect does hormone therapy have?
Well, the WHI trial that was published earlier this decade, or the prior decade actually, in 2002, actually showed that there was an increased risk for ovarian cancer. However, that's not natural hormones, those are synthetic hormones.
We're almost out of time. How do you prevent it? Anything you can do?
Stay in good health, watch for the signs, catch it early if you can, really.
All right.
All right. Dr. Paykel, thanks. Got a question for the experts. Send them an email, asktheexpert@today's TMJ4.com. You can also leave them a voicemail.